Hello, welcome to another presentation from Presidential. In this PowerPoint, we will be looking at the processing, safety, and quality assurance of radiography, more specifically dental radiography. So, the aims and objectives for this PowerPoint is to provide guidance on the safety precautions required during taking and developing of radiographs, looking at quality assurance, and preparation for assisting during the process of dental radiographs. We will also look at the different types of radiographs that's available to us. So let's look at the role of the dental professional during the process of taking radiographs. The clinical area must be adequately prepared, which would include ensuring that any area that comes in contact with the patient and the clinician is adequately disinfected or sterilized. This would be the use of barrier shields, correct PPE, and also sterilized radiograph holders, which would go into the patient's mouth. Must ensure that the appropriate radiographs are available and the correct films are also available under the guidance of the clinician. We must ensure that all the relevant equipment is available and machine is switched on. Correct PPE must not just be used by the dental professional, but also the patient should have the appropriate PPE on. We must also ensure that safety precautions are met and kept during the whole process of taking the radiographs. So let's ask the question, what are dental x-rays? Dental x-rays are images taken of the teeth by using low levels of radiation to capture these images. This may be in the intraoral environment or the extraoral environment. This can help and provide a means of the dentist assessing various different types of problems. These problems can include cavities, tooth decay, and impacted teeth. It also aids the clinician in adequately planning treatment. As we understand what radiographs are, we look at some of the benefits of radiographs. It's important for children to have radiographs as early as possible because this can often help us identify potential dental problems, which will then prevent a more invasive treatment at a later age. So the factors affecting how often you get a dental x-ray may include the age of the patient, your current oral health, any symptoms of oral disease, and a history of gum disease, known as gingivitis or periodontal disease. The potential risks involved in taking x-rays are due to the low levels of radiation emitted. Digital x-rays provide lower levels of radiation, but there are also certain precautions that your clinician can take to ensure that this level of radiation is reduced. This may be a lead bib, which is placed over the chest or abdomen of the patient. There are also thyroid collars, which may be used. Women who are pregnant or believe they may be pregnant should avoid all types of x-ray. As well as having the correct PPE for the clinician and the patient, there are certain safety precautions that must be taken. This is ensuring that the machine is working correctly and that all warning lights are switched on. Ensuring that the radiograph machine is switched off after the x-rays have been taken. And usually we require for the clinician to stand 2 meters away from the controlled zone. This is where the x-ray would be taken. This limits exposure to the radiation that would be emitted. The x-ray machine must also be disinfected before and after use. So as we've identified, dental x-rays helps the clinician in effective diagnosis and treatment planning of the patient. Let's have a look at some of the most commonly types of dental x-rays available to us. These include periapical, interproximal, also known as bite wing, panoramic, also known as OPG, occlusal, cephalometric, and CBCT, also known as cone beam technology. Periapical x-rays will show the entirety of the tooth and the surrounding structures. This would be from the crown of the tooth to the apex, which is the root. Periapical x-rays helps us identify various different types of issues. This may be a poorly treated patient who may have had a root canal treatment or a post-stem core, or even issues with an implant placement. It also helps us identify abscesses that has occurred within the surrounding structures itself. This may be at the root of the tooth or within the bone itself. It also helps us to identify certain periodontal disease which has affected the alveolar bone itself. Bite wing x-rays are usually taken of the crown of the tooth to the supporting bone's structure. This helps us to identify potential problems specific to individual teeth. This may be changes in the thickness of the bone caused by a severe gum disease, but also cavities within the tooth structures itself. Occlusal X-rays will provide an image of the teeth within the entire arch. This may be the upper or lower jaw. This helps us identify potential problems with erupting permanent teeth, orthodontic treatment, or even patients who may have had trauma. A panoramic X-ray, also known as OPG, is a wide image of the lower face of the patient. This allows us to view all the teeth within the patient's mouth, both upper and lower jaw. It allows us to also see the surrounding structures. We can identify potential problems with the development of the teeth and bone, allow us to see impacted teeth, and also identify the TMJ to assess if there are potential issues. A cephalometric X-ray presents us with an image of the head and neck of the patient. This helps us to identify any potential problems with the development of these structures within the patient. This may be more useful to an orthodontist or a surgeon to plan treatment, but also to monitor the development and growth of the patient. Digital X-rays, known as CBCT, cone beam computer tomography, is an X-ray which is more commonly being used. This presents us with a 3D point of view and may be useful in identifying a number of potential issues as well as diagnostic for treatment planning. This allows us to identify bone density for implant placement as well as a number of other issues, which may be abscesses within the patient's mouth, but also various defects within the bone itself. After the radiographs are taken and developed, they have to now be assessed to ensure that they are fit for purpose. We use a grading system to identify potential problems and to ensure that the radiographs are clear to present the image required. The grading system used would be grade 1, 2, and 3. Grade 1 would be excellent quality of the radiograph after development, and there would be no visible errors with the image. Grade 2 is diagnostically acceptable, however there may be some small errors such as scratches or impurities present on the radiograph. However, we are still able to see the image required and use it in assessing the patient. Grade 3 would be unacceptable as we are not able to use the radiograph for the purposes taken. Thank you for watching this presentation. We hope that this gave you a basic understanding of what radiographs are and how they aid us within the dental profession to adequately treatment plan and carry out diagnosis. Further reading would be required to get a more in-depth understanding of the various different types of radiographs available, how we develop them, and also the different types of machines we use to take these radiographs.